I'm Shebni Hameed, clinical dietitian from Universal Hospital. Today I'm going to discuss about diabetes meal plan. Diabetic meal plan is a guide that tells you how much and what kind of food you can choose to eat at meals and at snack times. Some of the techniques include the glycemic index, the plate method, and the carbohydrate counting. The right meal plan will help you improve your glucose, blood pressure, cholesterol, and helps you keep your weight under control. Before going to the meal plan, we need to know what is diabetes. Usually the foods which we eat, especially the carbohydrate foods like bread, potatoes, corns, fruits, fruit juices, these are the carbohydrate foods. Once we eat that, after digestion, it is converting to glucose. Usually there is insulin production from the pancreas which helps to control this glucose and give it to the cells for the energy purpose. If the insulin is less in our body, the production of insulin is less or the action of insulin is less, this converted glucose remains in the blood itself. This condition is called diabetes. So the carbohydrate is the main culprit. So one method is to increase the production of insulin in our body. It is only possible by doing exercise. At least include 45 minutes of exercise 5 days in a week if your health is okay. The second thing is controlling the eating habits. There are two types of carbohydrates. One is simple carbohydrates and the second one is complex carbohydrates. Simple carbohydrates, which means there is no fiber in it, no vitamins, no minerals in it, like white bread, white kubus, fruit juices, sweets, sodas. These are simple carbohydrates. Once we eat this, it converts immediately into sugar because there is no fiber in it. So the graph will be like this. So we have to avoid these kind of foods. The second group is complex carbohydrates, wherein it has more complex fibers. So it takes time for converting into glucose. The graph will be like this. So this type of complex carbohydrate is okay to have in this condition. But again, we have to take care of the portion size. Too much complex carbohydrates at the same time is also not advisable. So small and frequent meals will be advisable. So in simple way, at least if we are including more fibers or more vegetables along with each meal, it will help to control the sugar level. Each body is unique. The production of insulin or the action of insulin vary from one to one. So meeting a dietitian and a doctor for the medication and the eating habit is very important. Eat your meals on time. Lead a healthy lifestyle. Thank you for watching.